Hello everyone, I'm Ana Monteiro. I'm a medical oncologist specialist and I work in Nsambya hospital since April 2024 in the cancer department. What to say about cancer? No, many things, but maybe cancer is abnormal growth of some cells of our body that grow in a way that we cannot control. So they kind of do these swellings, for instance, or it can be abnormal mass, which we call a tumor, no? And then we have to do some investigation. But where do they come from and why do they arise in our bodies? So we say the factors that contribute to the cancer development are many. It's not a matter of genetic, or at least only about the genetic. Environmental factors matter, like tobacco use, alcohol consumption, either viral infection like hepatitis B, C, HIV. They can predispose our bodies to be more at risk to develop cancer. Also, we know that obesity also increases the risk of some cancers. Also, if we are not physically active, we know that also contributes to the development of cancer in our bodies. So what can we do to prevent cancer, for instance? We can adopt healthy lifestyles, no? Like food, which is a healthy food. Traditional food is good, by the way. Then also do some exercise. And if in case of any abnormal swelling in the body or some persistent, long-standing symptom like cough, difficulty in breathing, let's come for checkup. Let's come to understand what is going on. So I think when we speak about cancer, we have to know that unfortunately is a disease which is very prevalent worldwide, all over the world. And in some countries there are some cancers which are more frequent, like all over the world we know breast cancer, also lung cancer, colorectal cancer. For instance, in Uganda, we know in women we have a high prevalence of breast cancer and cervix cancer, and in men, the prostate cancer. Then for both sexes, we know that the esophagus cancer and liver cancer and some forms of lymphoma are also very prevalent. So it is very important. Any abnormal thing in our bodies, we come for checkups, and if we have doubts, we can come. There are also programs for screening. Screening means do some specific tests to see how, if we have any risk factor that is indicating that maybe we have any risk of cancer. What should any of us do in order to prevent cancer or screen for cancer or diagnose it in an early stage, no? It's a bit different depending on our age group and also our sex, men and women, but we know that there are some measures that were adopted everywhere. Like for instance, for women now, we have the HPV vaccination. But in case the women are not yet in the age group that underwent the vaccination, there are other tests they should do, this gynecological screening for cervix cancer, which is the pap smear and other tests. You come for screening for cervical cancer, they'll tell you what to do. Then, another thing women must be aware is the prevalence of breast cancer is high. And that thing may start with a simple auto-examination. Then you can also come for screening if you have any abnormal swelling or in the breast, or for instance, if there is any case of breast cancer in your family, you should come before, let's say, some years before the age where your relative has presented with that cancer. Usually say 10 years before you start coming for checkups. Then a man, usually around 50 years, we say it's important to do screening for prostate cancer. Also, it's important to adopt healthy lifestyles, both sex, men and women, because we know if we consume fruits and vegetables and do exercise, we have lower risk for colorectal cancer. Or for instance, if it's the case that you know a person or you are the person affected with HIV, hepatitis B or C, it's also important you come for screenings. Not only to treat the HIV or the hepatitis, but also to come for screenings. There are some particular cancers that you might be at risk. So we can do those specific screenings, some tools for liver cancer and others. So it depends on an individual basis. So if you want to know, you can also come for counseling and checkup, and we try to understand at your age, at your sex, and other comorbidities that you might have. Comorbidities means other diseases that will help us to understand what is the screening we should do. For the oncological team, we say when we meet a person with cancer, we are together in this journey. But sometimes we face challenges. Patients face challenges. We also face those challenges, no? Challenges, especially when we feel the treatment is no longer working, or when you feel that maybe what you're doing is not enough to stop that disease and that cancer is taking over the situation. So those are very difficult moments for us to understand that maybe right now is the moment we have to start giving you the best dignity we can, relieving all the symptoms that you have that make you feel better and make you live with dignity. Of course, the most difficult moment for us is when we lose someone, when we lose a patient, because it's like, okay, it's not a relative, but it's someone who we have established a relationship. So it's part of you also. So we suffer also with the family, no? Because we have been together a journey. So those are the most difficult moments. Mm-hmm.